physician assistant in the emergency room.
Good.
I had my near-death experience in July of 2000. I was trained in medicine. I was a very pragmatic person, and it was challenging for me to accept that this spiritual thing had occurred and that I had remembered who I was. In my life, it didn't really apply. I had just finished PA school 3 weeks before my daughter was born. All my training had been sort of taken away. The information was there, but it would take me a long time to retrieve it. I spent a long time just getting back into my life, raising my daughter, trying to be a wife, starting a new career, and my near-death experience went to the back of my mind. But it kept prodding me, poking me, telling me that I needed to deal with it, to feel it and process it. Well, fast forward 10 years later, I finally did start to process it. And it was through a personal family crisis where I had spent all these years avoiding it and trying to find some peace in my life. All the while, my near-death experience is poking me and prodding me and saying, I'm here, you need to acknowledge me, and I'd stuff it back away. During that process, I did finally learn how to speak to people about it. My colleagues in the medical field, they have, while I haven't disclosed my entire story, they are aware that I had a near-death experience, and for the most part, they're very supportive. So now where I'm at is I'm talking about it. I am ready to share this more with the medical community. I work in an emergency room. It's a very, sometimes a very intense, life or death situation that you find yourself in caring for patients. When a patient comes in cardiac arrest, or they've had some other kind of medical emergency where they may not be conscious when they come in, they may not have a heartbeat when they come in, we get it back in the ER, they become conscious again, maybe just briefly, intermittently. There are opportunities there for us to, as healthcare providers and human beings, in dealing with other human beings, we can help them to, if they've had a near-death experience, have had something happen to them in the interim, to express it, to give them the ability to simply say, I have had this happen to me and this is amazing, or this was terrifying, or whatever it is. As a matter of fact, there was something that just happened a few weeks ago with one of the physicians I was working with on my shift, and there was a man who came in cardiac arrest. He had been down for 5 minutes. He came back in the emergency room. She happened to be at bedside when he came back. And she said he opened his eyes. He was intubated at this point, so he couldn't talk. She said he opened his eyes and he looked like he'd been somewhere. And I kind of laughed, and she wasn't somebody I had told yet. I almost said something, but it was so chaotic at that time in the emergency room, I didn't feel like I could get a good audience with her. And I made a mental note to go back and mention that particular situation. What I would have liked to have heard, being a patient in that situation and appearing as if I'd had an experience, is tell me about it. What can I do? I'm listening. I'm here. And that would have opened the door, given me permission to express myself. I wasn't given that opportunity in the hospital because I didn't remember my experience. Had I remembered it, had I come out and known where I had been right away, that's what I would have wanted to hear from my physician.